Thanks for staying with us. The National Coronavirus Command Council is due to meet tomorrow as 14 days of alert level 4 lockdown restrictions are set to come to an end. So then, as COVID-19 infections and deaths continue to rise, the council faces a tough balancing act on whether to extend these lockdown restrictions in order to open up the economy, for example. To look at whether the tougher restrictions have helped to bring down infections and if government should indeed ease these restrictions, I'm joined by Dr. Mvuyisi Mzukwa, chairperson of the South African Medical Association. Doctor, afternoon to you. A pleasure to have you on the program. So I was looking earlier on the 27th of June, which is when a lockdown was announced. We'd recorded about 15,000 new infections. Yesterday, we recorded 22,443. So has the lockdown really helped?
Well, good day, Temegile, and to your viewers. Thanks for having Sama in your program. I'm the vice chair of the association, Temegile. I think we need to observe few things or few factors, to talk about whether this has had any impact or not. The first would be the pressure on the healthcare system, whether hospitalizations have gone down or have not. The other thing that we need to consider, we raised this issue when we were calling for stricter restrictions. We were worried about the enforcement, and also we called upon all other role players like your hospitality industry or liquor industry to come on board in terms of enforcing the restrictions, making it possible for the infections to go down. But as you alluded to earlier on, I don't believe that we have gone any better in terms of taking down the infections. I know that we're looking at the weekly average, but if you look at the number of hospitalization, I think we have not made any significant impact.
I don't know if you've seen in the last 2 days or so, there's footage circulating online that was filmed by an international television news crew of an overcrowded COVID-19 ward, apparently, where doctors are saying it's patient on top of patient, and they're battling to deal with what's going on there. Is that what you are hearing across the board in Gauteng specifically?
This is what we are getting from our colleagues, and we see colleagues giving us feedback of ambulances waiting outside, having no space. Inside of them there are patients who are critical, and there's no space to accommodate those patients inside the hospitals. But we know that some of these patients are being managed at home because there's no accommodation. Even if we have beds, they don't have any manpower, to be looking after those patients. So this is exactly what we are still hearing from the colleagues from Gauteng.
Gauteng, again, the health minister in the briefing, the acting health minister, Mameloko Ngubane, in leading the briefing on Friday morning, said indications at this point, early indications, are that the province is either past or nearing its peak. But at the moment, Gauteng has somewhere in the region of 99,000, I think, active cases. When you look at that sort of data and what you've just described as far as conditions in actual hospital wards, do you think this province needs level 4 lockdown just a while longer, perhaps a few more weeks?
I think it will specifically be relevant with Gauteng to really look at, because we have not reached the peak. We are being told that we are getting there, but we have not gotten there as yet. The other thing, Tembegile, that is also compromising this whole thing is these political gatherings that we take them as super spreaders, because in most of these cases there are there's no wearing of masks, there's no social distancing. But on top of that, we need to relook at our vaccination centers as well, whether they are contributing as super spreaders or not. So that's one thing that we actually need to look at as well when we consider all these factors.
Key to the issue of vaccinations now is that conversations are ongoing with Treasury, and we'll soon see public sector vaccination sites opening up on weekends as well. Are they functioning optimally currently, especially with the goal of vaccinating about 200,000 people now in sight per day?
But the challenge, Tembekile, is that you get sites where, it's literally empty. And there are sites where you've got lots of people gathered in one place. I think that's what we need to manage. But also, we still need to make sure that we talk to the public. We are specific on the messaging that we are getting out there in terms of addressing the problem of hesitancy, if you call it. So that's what we need to do, because the hope is that if we expand the categories of people who are coming in for vaccination, we are going to be, making headway in terms of getting to higher numbers of vaccinations. But that's not what we see. At times, in many cases, vaccination sites remain empty.
Initially, in government's first presentation on vaccinations, the idea was to vaccinate people with comorbidities first. I'm thinking off the top of my head, people who are diabetic and obese South Africans. We're now moving into a more age-based vaccination targeting program. Is it necessarily most effective, or is this a blunder to step away from vaccinating people with comorbidities before everyone else?
I think it's reasonable. I think it's reasonable to be looking at the age base because, for example, if you look at those above 60 of age, those people, we expect lots of comorbidities. But come to the 40s as well, 40s and above, that's where, when they say life begins at 40, I always say life of illness begins at 40. So we need to be sure that those people, especially those are above 40, they are the category that almost has lots of comorbidities there. So I do think that we need to stick to this age base, unless honestly we look we are encountering a new evidence in terms of how we can approach this vaccination criteria.
And with cases now going up in the Western Cape and some of the other provinces, I'm wondering how much information sharing strategy is going on between the various provinces, because this time last year, the Western Cape was the epicenter. How much of the knowledge from dealing with a disaster at that level in the Western Cape then, and what we've seen in Gauteng in the last month or so, is actually shared so that others know how to best respond and perhaps even improve on the responses of provinces that have already seen the very worst of COVID-19, at least domestically?
I believe that we need to be doing that. I hope government officials are doing that, because it's not acceptable that in the third wave of this coronavirus, we have not learned lessons. It looks like the picture we see now in the Western Cape is that the government has learned some lessons there, which I think they are implementing. Unlike in other provinces where, even those that don't have any third wave at the moment, it's just, relaxed. There are no plans in place to say, what if we're getting a surge in the numbers? So I do think there should be that moment, and I hope that is happening within the government circles.
Doctor, thank you very much for speaking to us as always. That was the Deputy Chairperson of the South African Medical Association, Dr. Mvuyisi Mzukwa, talking to us about COVID-19 ahead of a meeting by the National Coronavirus Command Council. Will we stay at level 4 of the lockdown when the President addresses us at the end of the 14-day lockdown? That is due to happen tomorrow, Sunday. So an announcement, we'd imagine, from the President imminent in the coming days.